Officers now say clinical officers will down their tools of frustrations in the collective bargaining agreement negotiations. Union Chair Peterson Wachira says a decision on the strike notice will be issued after an advisory council meeting slated for the 16th of February, that is next week. Miriam Nyambura now joins us live from Nakuru with more. Miriam, what can you tell us about the reasons behind this call, or the call that they are processing to call for strike?
Well, good afternoon, Sam. And indeed, what the Kenya Union of Clinical Officers are saying is that the process of implementation of the CBA has stalled since December 2017. So for them, they're accusing the Ministry of Health as well as the Council of Governors and the Ministry of Labour for failure to meet their end of the bargain. But earlier on, they had a press conference, and this is what the officials had to say.
The Kenya Union of Clinical Officers wish to express our dissatisfaction with the manner which the Minister of Health, the Council of Governors, and the Minister of Labour have handled the Clinical Officers Collective Bargaining Agreement negotiations. We have exhausted all the alternative dispute resolution mechanism as provided for the law and are now left with the single option of strike.
Well, some of the issues that the Kenya Union of Clinical Officers were saying is that there's the failure to implement the comprehensive medical cover for the clinical officers. The Secretary General as well as the Chair saying that there are only 4 counties out of the 47, including Meru, Busia, Makueni and Kajiado, which have fully implemented the comprehensive medical cover. And other issues also arising include training of the clinical officers as well as payment of interns. But just joining me here is the Kenya Union of Clinical Officers Secretary General George Gibore, just to shed more light on some of the issues that are arising from this. Thank you, George, for joining us. Maybe you can tell us what other issues apart from the implementation of the comprehensive medical cover, training, as well as payment of interns. What other issues are arising?
Thank you very much, Anne, for having us. And we want to say this is the voice of the disgruntled clinical officers in the country, because we are saying that we have been plantedly been discriminated by the state, that is the government and the employer, on a number of issues amongst that you have mentioned. The other issue that we are talking about is the palpable discrepancies on salary and allowances, which we are saying that the government must implement and ensure that they're harmonizing for equal pay, equal work done. The other issue we are talking about is pension, that our members must be on pension. Put on pension, because there are people who are devolved and they are not on any pension. They are working for over 10 years now. There have been issues that has been pending since devolution and even before devolution. Issues of promotion must be done, and these are issues that we are agreeing that must be done promptly, as it will be provided on our recognition agreement, on our CBA. The ministry and the Council of Governors walked out of the CBA negotiation. We have exhausted all the provided mechanism to ensure that these issues are addressed, and that's why we are saying that we are choosing to go for the last result as it is provided on the Liberation Act.
Therefore, what solutions do you have at the moment as officials of the Kenya Union of Clinical Officers?
The solution we are having, that this is a legally formed union and it has structures. Now, we as the NEC, we are feeling that the issues of conciliation has hit the dead hand, and we are actually calling on the ADC to advise which way forward. The way forward can only come out of what the Constitution under Article 41 provide, and the Labour Relations Act under Section 54, which provide that if there is a stalled negotiation, then we can be able to choose, even including to go on strike, which cannot be avoided. Because now we have done several petitions to all the multi-sectoral of agents of the governments, and they have not actually done anything. So we are saying we use our last result to ensure that we are pushing them to come on the table and finalize on less than actually 10% of the CBA parts that have remained. Yes.
So you're having the meeting on 16th of October. What are some of the issues that you hope to be addressed, as you mentioned?
Thank you very much. We will be communicating to our members who have given us the mandate to represent them and to negotiate on their behalf. And they will advise us according, and I've said that already the provision under the Liberation Act is very clear. Now they will give us a mandate to call for strike. I'm saying this is pending since 2017, where we had a return to work formula, provided a guideline, a timeline on how we were to engage. And I realized the CBA, which now has stalled, and a recognition agreement which the Minister of Health has not signed, and a number of other issues which we are saying they are quite achievable, and this historical discrimination against clinical officer must come to an end. Yes.
Okay, thank you. There you have it, Sam, the Kenya Union of Clinical Officers saying that they are going to hold an advisory meeting on the 16th of February this month, just to shed more light, or rather to make sure that they will discuss issues, if they will have a strike notice or not, and the way forward concerning this, because they're mentioning that they've been pushed to the limit. Back to you, Sam.